I'm really pleased to introduce the next speaker for today. Cheryl Dizon-Reynante is our clinical lead for psychosocial oncology at CancerCare Manitoba, and she's a counselor for us as well. And she's going to be presenting on Tame the Worry, Coping with Fear of Cancer Recurrence. So as she gets set up, I'm just going to, and she gets ready to take over, I just want to remind everyone, if you have questions as Cheryl's speaking, please put them in the Q&A as you think of them, and we will make sure that we circle back and have a look at those at the end and cover as many of them as we can. So with that, Cheryl, over to you.
Oh, thank you so much, Donna, for that introduction. It's so nice to work with you again. Hello, everybody, and good morning. And so, as Donna said, I get to work with a small in number but mighty team of counselors at CancerCare Manitoba. And this particular topic is near and dear to our hearts because taming the worry and the fear and the anxiety of cancer returning is something that we hear about a lot. And so, we are just going to unwrap and talk out what this means. Like, what is fear of cancer recurrence? And so, before we get into the meat and potatoes of the discussion, I do want to make a comment, as you've probably been noticing throughout the conference, that a lot of consideration has been made towards minimizing, decreasing any negative impacts on people and populations that are underserved. And if you're curious about this topic of health equity and why it's so important to us over here at CancerCare Manitoba, feel free to check out the booth that is titled CCMB Underserved Populations Program, because there's a super duper good video on there that speaks to this, idea of health equity and why it's so important. And so the three main hitters that we want to get to today is let's talk about fear of cancer recurrence and define it a little bit. As well, what does this fear look like? How can it appear in conversations with people affected by cancer? As well, and most importantly, tips to manage and decrease fear of recurrence. And you're going to find that it dovetails off of the keynote speaker by Dr. Rob Rutledge last night, who already sort of primed us for some tips and strategies for moving forward after cancer treatment. Okay. So, what is fear of cancer recurrence? So, before I get to the definitions that some researchers have offered, I actually want to call your attention to the right side of the screen here, which I think is a pretty good depiction of how somebody affected by cancer can feel like and look like. And really, I mean, I see overwhelm, I see uncertainty, I see angst and fear in this picture. And when people come through our doors at the counseling office, we tend to hear statements and themes such as, I feel like the worry is always there and I can't get away from it. Or it's like a dark cloud that follows me around all the time. Or it's almost like there's a little monster or a gremlin that's sitting there at the back of my head or on my shoulder. Sometimes we hear things like, my mind often goes to all the what ifs and I can't shut it off. What if something was missed? What if there's something I can do better? I don't know what caused the cancer, so how can I take steps to make sure it doesn't come back? Or, oh my goodness, Cheryl, I had such a headache yesterday, and I couldn't get past the thought that the cancer had returned. And then when we talk it out, we realized that she had spent the whole day entire gardening in her backyard and was out in the sun. So fear of cancer recurrence can look like that, and how researchers have defined it, you can see here. One group defines it as fear, worry, or concern relating to the possibility that cancer will come back or progress. Another group of researchers say that fear of cancer recurrence, or FCR, you'll see that a lot on my slides here, is a common existential concern and source of distress among adults with a cancer history. So, really, what these definitions are getting to, folks, is beyond the physical part of cancer, because I'm sure all of you would agree that it doesn't just affect the physical part of a person or the body, it gets to affect affecting emotions, mental health, even social relationships can be impacted, existential. And what we mean by that are big, not necessarily spiritual or religious, sometimes that's the case, but how do I move forward now? Who am I now? Do I want to go back to being that person I was before? I don't know. I don't know if I want to do that. So all of this is tied up with this idea of angst and anxiety and fear. And I just so appreciate the thumbs up that I'm seeing here, because it tells me that it's striking a chord with some of you out there. So thank you so much. So who does fear of cancer impact? Not surprisingly, patients. Of course, the person diagnosed with cancer is going to have this fear. Not a surprise that the research supports this as well. And you'd actually be surprised maybe that the research says 1 in 2 patients experience some level of the fear of this fear of cancer returning. So 50%, right? So whether this is not you, whether these thoughts and worries come to you, that's normal. If they do, to some extent, even in a mild sense, occasionally, that's normal too. And so, whether or not you fit in one of these two categories, what we want to do for you today is to start naming this unmet need that can come up because people don't know how to talk about it with their loved ones, with people they trust. People don't know how to bring this up sometimes to their medical team. Sometimes, when you kind of keep these thoughts and worries inside and the bad movie keeps playing, you kind of stay stuck there. Whereas when we start talking about it through events like this, or if you have that safe person in your life that you can talk this stuff out, the bad movie changes and is out there, and you can process it and name it. And when you name it, you tame it. So that's, I can't take credit for that. Dr. Siegel is a very well known psychiatrist who says, name it to tame it. So name it to tame the fear. And so before I get past this slide, I want to underline there the note that says, and their caregivers too. So there is research as well that says and supports that caregivers can experience this level of fear of cancer returning as well. So we don't want to forget those important support people out there. So, yes, the fear of cancer recurrence can also affect certain populations. So, research is finding that there are certain groups right there beside the green check mark that can experience higher levels of fear and anxiety. And so, women fall into that category. People who identify as women can experience higher levels of this fear of cancer returning. Younger patients and their caregivers as well. And so by younger, we're talking about age 50 and younger. As well, those patients and their caregivers who witness the patients go through cancer and cancer treatment, those that experience many physical side effects can have that higher level of fear that the cancer is going to return. But quite surprisingly, the lower half of this slide here talks about factors that you might think would be predictors of the cancer, of that fear being high for some folks. It's actually not. There's no correlation being found there. So, treatment regimen, whether or not folks got chemo or radiation or hormonal or surgery or some combination of that, no evidence that says that one type of treatment leads to higher levels of fear of cancer returning. Also, time since diagnosis, whether you're 2 weeks post treatment or 2 years post treatment or anything in between, no direct correlation as to predicting how high fear is going to be for folks. And I really want to talk about this last item here, actual risk of recurrence. No relationship, folks, regarding how, what the actual percentage and statistic that's been quoted at you, perhaps by your oncologist, your actual risk, no correlation to how high your fear is going to be. But what we want to speak to today, underline, is that it is actually the perception of your cancer returning, the belief that your cancer returning that is going to lead to higher levels of fear. And so, an example of this could be, let's say, a person diagnosed with breast cancer has gone through treatment, has been told by her medical team that she has a low risk of the cancer returning. So, let's say 10%. Yet she walks through my counseling door and she sits down and she tells me, you know what, Cheryl, I'm 100% sure that the cancer is going to return. It's just a matter of time. And so, not surprisingly, when someone's belief is that the cancer is going to return, they are going to experience higher levels of fear, higher levels of anxiety, and this is going to impact possibly their quality of life, relationships, returning to work, for example, all kinds of things. And so, again, we want to underline that it's the perception that correlates more highly with this higher level of fear of cancer recurrence. And so, what can FCR look like? And so, again, I touched on the fact that it can be very normal to experience some level of it. And under the mild category there, that kind of makes sense that you're going to have occasional thoughts about cancer when you have a scan coming up, when you have a follow up coming up. And so, leading up to the days or the week before that appointment, of course, there's going to be peaks in anxiety that are going to last perhaps a few days and sort of disrupt how you're feeling. But after that appointment, after the scan results, these feelings tend to resolve, and so that is what we can expect. And you're normal, of course, if you feel that way. Then we kind of get into the moderate and severe categories, where moderate is maybe more frequent thoughts, so maybe more than once a week, where there are no obvious triggers that are coming up, so no appointments or scans, nothing that you can maybe put a finger on, yet the worries about cancer returning pop up. And again, I want to highlight that a part there in moderate and severe that says the belief that one can't control thoughts, the belief that cancer will come back. These are things that correlate with these higher levels of fear and distress. And so when we get into the severe category, what that can look like is constant and intrusive thoughts about cancer that really just zip in there out of nowhere, where no external triggers are happening. And by external triggers, I don't want to only categorize it as a medical appointment or scan. It can be seeing commercial ads or radio ads. October is breast cancer month, and we've just gotten past that. So lots probably in the media about fundraising events and things like that. So those can be triggering for folks, but that is something that's an external trigger, and it's normal to experience an emotional reaction. But sometimes we see behaviors such as constant consults with Dr. Google. Dr. Google has very good office hours where it's 24/7, and some people can, look for reassurance online. But we want to underscore the importance of empowerment and knowing what you can do and what's relative to your own particular situation and case. And Google doesn't know that. And so we're going to talk a little bit more about communication with the medical team. But again, these are behaviors that we tend to see happening sometimes, calling into the medical clinics often to looking for reassurance, or maybe even avoiding the appointments and scans and calls from your team because it tends to result in spikes in fear. And so the message, again, another one that we want to drive home today, is that if this is you and it is starting to infringe on your quality of life, on relationships, on moving forward, please consult with one of us because we can talk it through, we can provide resources, and most importantly, we can highlight some tips and tricks and tools that you can do to foster that sense of empowerment and plan that you and your loved ones can implement starting today. And so, just a quick note as well on what can contribute to higher levels of fear: previous losses, past traumatic life events, current caring roles where you may feel that you're sort of pulled in 100 different directions at once. That's been shown in research to lead to higher levels of fear and anxiety. I want to zip down to the bottom part there that talks about unhelpful beliefs about worry, even. So sometimes we hear around these parts, if I worry about cancer coming back, I'm going to be prepared. So actually, there's a purpose for worrying so much, or a belief that all of this worry is going to make my cancer come back. It's bound to happen because I'm worrying so much. So, but even just being here, folks, and listening to this and taking a step back away from worry patterns and taking a look at this from a distant point of view, I think is going to be helpful. Because again, when you take a look at through a different lens of these thoughts, and recognize that a thought is just a thought is not fact, that it can help with moving forward after cancer treatment. And so, yes, zipping back up to that top right rectangle there, lack of information. So, lack of knowing what the actual risk of recurrence is can go a long way towards calming those fears as well. Oh, and thank you so much for the thumbs up. That thumbs ups that lets me know that I'm on track here. So, another thing that you can do to help reduce the fear of anxiety is to seek appropriate medical information with your team. And so this may or may not be difficult for you, though. Some people are super, they like the info, they like all the results, and that helps them to calm. But others process information differently and can feel overwhelmed by a lot of information. However, just the right amount can lead to decreasing that fear because you know more of the facts that pertain to your own specific situation. So, talk to your medical team about questions like, what are signs of cancer progression or return? Who should I be reporting these signs to? What should my follow up care look like? And what can I do to lower my risk? And so, again, as Dr. Rutledge says, a whole schwack of things that you and your loved ones can do to increase overall wellness. And so, I've had many clients come through my doors who have been highly anxious and are, on the internet looking for information, yet they haven't spoken to their medical team about these questions. So, for example, somebody may be super concerned about these body symptoms that are happening, achiness. What is that? My brain isn't working properly. I feel foggy. It must mean that the cancer is returning. But in a couple of situations where I heard this, and then they talked to their medical team or a nurse educator, they learned that they were actually side effects of the hormonal medication that they were on. And so, after tweaking the medication, talking to their medical team, they realized what was happening. And so, the medication was tweaked, symptoms decreased, and this also led to a decrease in fear and anxiety. So, taking control, folks, tips and strategies to tame the worry. Again, we're revisiting some of the great tips that we heard last night from the keynote, but prioritizing yourself. It may be hard to do, especially if you've taken a caregiver role for most of your life or for a long time. But taking care of your own needs is just so important. And so, whether that for you means prioritizing adequate sleep, exercise, and diet, encouraging and engaging in regular relaxation, meditation, yoga, gardening, baking, crafting, painting, music. All of these things are outlets that clients have told me, patients have told me, help them to tame the worry. As well, we want to normalize these fears by talking about it. So you hear today, this may be the first time, I don't know, that you've heard about some of these concepts about it's normal to have these fears of cancer returning. However, these are things that you can do. Yeah, we want to start the conversation, keep the conversation ongoing because mental wellness and emotional wellness are just so important for you all. Setting priorities and life goals, establishing a routine, all of us, this gives us meaning and a sense of direction and purpose in life that, yes, keep us focused rather than revisiting regrets and sadness about the past, as well as worries about possible future. And so, yeah, being in the moment, being directive in terms of what you want out of life, as well knowing your triggers. So we talked about that a little bit. That it's very common for commercial ads, for fundraising campaigns, for upcoming medical appointments. But even knowing your triggers, like, oh yeah, that was the shirt that I wore during chemo. That's going to trigger some angst. But knowing what those things are, a song on the radio even that was popular during that time. I mean, that can be a trigger. So just telling yourself, okay, there's a trigger, I see it, but this is my plan as to how I'm going to handle it. So talking to a friend, even sort of giving yourself that soothing, I don't know if you can see me, touch that recognizes that, this is a moment, but it will pass, goes a long way. Finding good social supports. And by good, I want to, maybe that's not a good word, good, but just knowing who you can talk to actually verbalize these fears without them being minimized or, oh, you're going to be fine, or think positively. We kind of got to look out for the positivity police because they're great and they have good intentions. However, it's not really realistic 100% of the time, because who among all of us can be 100% positive 24/7, 365? Nobody can. And so we also got to recognize the hurts and the fears and the struggle, because that they kind of live together with the joy and the happiness. If you stuff down one, you tend to stuff down other emotions. So if you release one, fear, anxiety, sadness, you also release the giggles and the joy, and find that coming back in again. Exercising self-compassion, super duper important. We all have that inner critic that kind of natters at us from time to time, but if we learn to shift that self-talk to, okay, this is a moment, I've been through a lot, of course this is hard, but I'm going to get through it. Things you would say to your best friend, sometimes we're not very good at talking to ourselves in that same tone, that same compassionate tone. Also, recalling what you did to get through other challenging times. It may be difficult when physically you're not feeling well, emotionally it's kind of rough, but recalling what you did to get through other times can be really important as well, because it speaks to, again, empowerment and resiliency, as well knowing how you best cope with stress. And so, again, we talked about that a lot last night. So many tips and tricks and good information that we got from the keynote that I'm going to try to quickly summarize here, not in words, but in pictures. Again, these are just ideas of some things that you can do to minimize that fear. And so, a ton of research out there, everybody, in regards to mind body strategies and being in the here and now. So, again, we're not kind of living in past events and also not ruminating about future possibilities, but we're right here in the moment and relaxing and focusing on basic things like breath and sound, and what we can touch. And so, tons of good research out there about the positive effects of meditation, mindfulness, prayer, being in the moment. Yoga does that for us, as well as Tai Chi. Lots of good research out there on Tai Chi and Qigong, and the benefits of that slow body movement, focusing on breath and that automatic relaxation response that can come up. And so there's a little pick in there about with art supplies that speaks to art, the benefits of art and crafting and pottery and sewing and stitching, like all kinds of things I get to learn about from patients that I work with. Music, even putting on music that is related to our youth, what made us feel good, putting that on can automatically rewire brain chemistry that's happening when we're feeling kind of down. As well, that thought bubble recognizes the power that we have to shift our thinking, and how that is correlated to then how we feel and how we behave, activities that we choose to engage in. So this really just summarizes even just a hint of what you all can do starting today. And so again, take home messages, everybody. Know that fear of cancer recurrence is very common. You know what? I think I skipped a slide. Sorry, I'm going to back up here. Yes, because I know I wanted to put in a shameless plug for myself. Some programs that are available at CancerCare Manitoba, you all have access to, because a lot of our programs are available virtually and online. There's mindfulness practice, the one that I'm starting to facilitate next week, Hope and Resilience, Cognitive Behavioral Therapy with Mindfulness, a long title, but it's a 6-week tips and tricks strategy-based course that you can take. We also have an expressive arts course. We have Moving Forward After Cancer Wellness program that we have in partnership with the Refit Center, all kinds of online groups that we can point to internally within CancerCare and with our external partners, and also tons of support groups. So we really want to be able to highlight some of the resources that are available to you. And so here we go. Take home messages, everybody. Know, please, that the fear of cancer recurrence is common for not only the person diagnosed, but for support people. When it starts to impact your daily functioning, however, relationships, quality of life, planning for the future, please consult with a healthcare professional, because we can talk it out with you, provide resources as needed. Please know that you're not alone. Also, knowing your triggers, we talked about that, and plan how you're going to handle them. That can be something that you can put in there in your toolkit, finding coping strategies that work for you and engage in them regularly. And also know that the goal is not to eliminate the fear of cancer recurrence, because then you might feel like you failed if you can't completely get rid of those thoughts. Nobody can get rid of worry thoughts 100% of the time. But the goal is to be able to manage this fear as best as possible. So I really want to drive those points home, everybody. And yes, I don't know how I'm doing for time, but I think that I've come more or less to the end, to the formal part of my presentation. And I think I'm just going to wait for um, my helpers in terms of questions and maybe even any thoughts that folks have.
Thank you very much, Cheryl. So there you go. See, you wish for a helper and one appears on the screen. Thank you very much for that. You've been a helper for so many folks here. That's pretty evident in the chat, as well as you've been seeing the thumbs up and the hearts that are coming from the participants. So thank you very much for such a great presentation filled with so much information and ideas and strategies on how we can all help to manage fears and anxieties, especially as it relates to the cancer recurrence. I just, as folks are, I'm going to we'll answer a couple of questions, just as I'm giving Cheryl a chance to sort of take a breath for a sec. I do want to note that we are wanting folks to tell us where you're from, don't forget. So at the top of your screen, beside the little trophy, there's a little square box, which is supposed to be a newspaper, and make sure you click on that and go to polls, and under poll, it'll put out some ideas as to which regional health authority you're from. If you could, in between sessions, if you could go visit that, we'd really appreciate knowing where you all are from and joining us today. So Cheryl, just a couple of questions that we'll ask before we wrap up. So there's a question about, Are psychosocial oncology supports through CancerCare Manitoba supposed to be just short-term, or can they last longer? Like, could they be months and years if the patient is receptive?
Wow, that's a great question. And I really want to just speak to, because cancer can be a very complex disease, so can the supportive services. So we always want to empower you and create goals and walk you through that. So want to be, of course, short term and empower you with moving forward. However, because things can happen that are unpredictable, we are in the picture as long as things are cancer related and how to move forward 100%.
Okay, thank you. That's great news. And just maybe you can give a little quick shout out. How does someone register for those programs that you were mentioning? I think you could probably go onto the website. Is that right?
Absolutely. The website, the booth on counseling services, please visit that. Reach out, phone number 204-787-2109.
Awesome, thank you. So yeah, folks, there'll be, go to the booths again for information on how to access Cheryl and her team. And as well, if you lose track of that, you can go to the website, and it is definitely a frequently asked phone number. Last question before we switch, just a note from one of our participants who notes that that they've had a close friend pass away from cancer, and then going through cancer treatment themselves really brought back the anxiety and fear of cancer returning. So do you have, how do we manage this combined grieving plus the anxiety that we're experiencing at the same time?
Oh, great question. And so please don't feel that you're alone. Please contact us because we do provide bereavement support as well, coupled with, yes, helping you work through your own cancer journey. So, as Donna said, the homepage will lead you to our Navigator newsletter, and that's the best way to learn about all of these programs.
Okay, thank you very much, Cheryl. So yeah, CancerCare is here for you, folks. So please reach out in whatever way you need, and in this case, through the patient and family support services. Just before we wrap up this session, so I want to thank Cheryl again and everybody for participating and the really great questions that we've had in this session.
Thanks, everybody.